I am the Vice President of the State Chapter for Healthcare Professionals, otherwise known as Unit 7. We represent RNs and other healthcare professionals throughout Massachusetts. We number about 1,800, and we include psychologists, psychiatrists, occupational therapists, physical therapists, speech and audiology, dentistry, medical, and of course RNs. I'm a psychiatric nurse who works at Taunton State Hospital, and I've been there for the last 25 years. I think that we bring a unique and important perspective to this process as we're the clinical professionals that are on the front lines of the DMH system. We are professionals who are personally accountable for the health and well-being of the clients served by the Coughlin. Because we are on the front lines, we see more and we understand more of what works and what doesn't work in the current system. We come here today with a great sense of urgency and with a deep concern about these proceedings and the work of the department. Our concern and our urgency has been fueled by statements made by officials at various facilities last week about a current plan to close up to 100 inpatient beds within the system by July 1st, as well as other unofficial reports of plans to close an entire facility within the coming months. Given the prospect that either of these drastic measures is being seriously considered, we are here to tell you that we believe that such a decision will have a dramatically negative impact and effect on the care of the individuals with mental illness and greatly increase the stress to their families and to the communities in which they live. The loss of these beds or an entire facility, combined with the recent dramatic cuts to community services and supports for the most vulnerable in our Commonwealth, will adversely affect thousands of individuals and family members. Mental health consumers who have relied on these facilities and these services for years will surely suffer. Many will become homeless, others will end up in the correctional system, and many more will find themselves at greater risk to themselves or others. First and foremost, we want you to know that M&A is committed to the position that wherever and whenever possible, people suffering from mental illness or other chronic conditions should be cared for in community settings with the greatest independence possible and with access to the services and supports needed to ensure their independence and well-being. However, there are members of this population that require a level of clinical care that is best provided in state-run facilities designed to provide that higher level of care. To understand the role and value of our inpatient facilities, one needs to have a clear picture of the clients we serve. At our inpatient facilities, including Taunton where I work, we take care of a significant number of forensic patients, which means they come to us from correctional facilities or the court system with varying levels of criminal involvement and some with violent behaviors and histories. At all of our facilities, we take care of many frail and elderly patients who can't be cared for in nursing homes. A large percentage of our patients, and this has increased over the years, have dual diagnosis. So not only do they suffer from mental illness, they have substance abuse issues as well. And this further complicates their placement in community settings. We have a number of women who suffer from trauma and who are self-abusive, suicidal, and need intensive mental health monitoring and care. These are the patients that often have nowhere else to go in the system. In fact, there is a shortage of psychiatric beds throughout the entire healthcare system in our state, including the public and private sector. Right now, we have psychiatric patients clogging our emergency rooms across the state, some waiting for 72 hours or more for psychiatric treatment and bed placement. I would also point to the Commission's own documentation on the webpage, which shows that the census at the facilities across the state was running at an average census of 97% as of May 13th. The same DMH document concerning the scope and purpose of this commission points to, and I quote, as you said earlier, an already significant reduction to DMH community services with the elimination of day and employment services and a reduced case management workforce. It further states, and again I quote, more than 200 of the 788 adult patients in DMH continuing care facilities are ready for discharge, but appropriate community services are not available. So if you admit that the community system cannot accept clients promptly now, how can it be done without risk of harm to our clients? Because that is exactly what you'll be doing. And in so doing, do not only increase the rate of homelessness, further clog up and destabilize our hospital emergency rooms, allow patients who are currently stabilized and safe to be placed in jeopardy, and in the end, drive up the cost of health care throughout the system, as we are forced to deliver care in more expensive settings, including our overcrowded jails. We urge you to make different choices. Specifically, we offer principles for our position on the future of inpatient services in the Commonwealth. Put careful planning for the clients before any other considerations. Please guarantee equal or better care. Provide transitional care. They will need this. Make true cost assessments. However the services are provided, state-operated services are preferable to privatized services. An increase in state revenue to fund the system. And if closures occur, they should be focused on removal of beds as opposed to the closure of an entire facility. We all want and strive for a system of care that is determined by the client, that is community-based and which fosters optimum independence. As frontline caregivers, we can't abandon our clients to a system based on false promises. Our professional licenses demand that we be honest with our clients and the public about the consequences of our actions and yours. We hope you will use this commission to make a thorough and objective analysis, one that provides a plan based on the needs of the residents of the Commonwealth, and that you fight for the resources to meet those needs. Thank you very much.